Hello, and welcome to our first episode of Body Restore. I am Robin Littlewood, a corrective exercise specialist and Kundalini yoga teacher. Today's exercises are going to help you with your stiff neck and sore shoulders, and you can do them seated in a chair, as I am seated now, or if you're in a wheelchair, you can also do these exercises. And I hope that these exercises help your neck and shoulders as much as they have helped mine. Please enjoy. The towel stretch. Grasp the towel firmly at each end. Inhale, and exerting pressure, pull the towel back behind your head, trying to keep your neck and chin pulled back. Inhale, exhale. Inhale, exhale. Repeat. Inhale, exhale. Inhale, exhale. Spinal twist. Inhale as you swing to the left. Exhale as you swing back to the right. Breathe powerfully through your nose only. Do not breathe through your mouth. Inhale left and exhale right. Inhale left and exhale right. Inhale left and exhale right. Shoulder shrugs. Inhale and shrug the shoulders up Exhale and let them drop. Inhale up and exhale down. Breathe powerfully through the nose only. Spinal flex. Inhale and pull your shoulders back. Keep your head and neck level and your chin tucked in. Exhale and squeeze the navel to the spine. Inhale forward, exhale back, breathing through the nose only. Inhale forward, exhale back. Inhale forward, exhale back. Inhale forward, exhale back. Inhale forward, exhale back. Arm pumps. Lock your elbows straight, clasp the hands together. Inhale and raise your hands over your head as high as you can while keeping your elbows locked. Exhale down. Move powerfully, breathing in and out through your nose only. Neck rolls. Inhale as the head rolls gently back. Exhale as the chin rolls towards the chest. Inhale back and exhale forward, moving to the left. Switch directions, continuing to inhale as the throat is open and the head is back, and exhale as the chin rolls gently towards the chest. Prone cobra. Inhale and raise the hands over your head. As you exhale, rotate the thumbs up towards the ceiling. Squeeze the muscles gently between your shoulder blades. Fire the muscles of your buttocks and squeeze the navel to the spine as you exhale. Inhaling the hands up over the head. Externally rotate the thumbs towards the ceiling. Fire the buttocks muscle, the shoulder muscles, and squeeze the navel to the spine as you exhale. Repeat. Inhaling the hands up over the head. Externally rotate the thumbs towards the ceiling. Fire the buttocks muscle, the shoulder muscles, and squeeze the navel to the spine as you exhale. Rhomboid push-up. Squeeze the shoulder blades together and relax your head and neck. Exhale and push the shoulder blades apart. Minimal movement should happen in your lower spine. Inhale, squeeze the shoulder blades together. Exhale, push the shoulder blades apart and arch the upper part of the spine only, leaving the lower part of your spine as stationary as possible. Remember to relax your head and neck. Prone lat stretch. Push the hands into the floor above your head as though you were doing a karate chop. Inhale. Exhale, push and stretch. Repeat. Inhale. Exhale, push and stretch. Rhomboid push-up. Squeeze the shoulder blades together and relax your head and neck. Exhale, push the shoulder blades apart and arch the upper part of the spine only. Prone lat stretch. Yoga mudra to stretch the chest, back, and shoulders. Clasp the hands behind the back. Close your rib cage. Inhale deep and exhale and tilt forward, stretching through the chest, back, and shoulders. Don't worry if you cannot come as high as is being demonstrated. Just do the best to get a good stretch through the shoulder blades. Repeat. Tilt forward, stretching through the chest, back, and shoulders. Welcome back to Body Restore. In addition to doing corrective exercises for your neck, we like to encourage you to use non-pharmaceutical and non-surgical methods for your neck pain. And something that I have found to be very effective in my own life is acupuncture. And I have with me today Mr. Jeff Helms of Performance Acupuncture. Welcome, Jeff.
Hi, nice to be here, Robin. Thank you.
So Jeff, could you tell us a little bit more about what acupuncture is and how it helps?
Sure. Acupuncture is the use of small needles. They're very tiny, and we put them in the body. We stimulate the nervous system, And through that stimulation, we can do a variety of things. For what you're talking about with stiff necks and sore shoulders, mostly we'll do it for pain management and to relax the muscle tissue, and also to help facilitate range of motion in the body.
Does it hurt?
No, it doesn't. It actually feels wonderful. Many people come in with the preconception that there's going to be some type of pain or it'll feel awful, and that's not true at all. You don't really feel them going at all. You do feel a small sensation when we get the connection with the nervous system. Other than that, it just feels wonderful. It's very relaxing. Most of my patients actually fall asleep on the table.
Yes, I would be one of those patients.
It's true.
I actually love my acupuncture. I know it doesn't hurt, but I asked you that question because a lot of people might be afraid that it is going to hurt. It doesn't. It feels wonderful. Tell us a little bit more about some of the other techniques that you have used to help me with my stiff neck.
Sure. Well, at my practice, Performance Edge in Ventura, we have, me and my team, it's not just me, there's more of us, but we use body work, we use massage therapy, we use acupuncture, we do use some herbal therapy, and mostly with my treatments, I combine all of these things together into one package to give you whatever you need that'll help your body best. Massage is a great tool, and body work is what we do, which is a little more strong. It's not the relaxing, put you to sleep type of therapy. It's vigorous. It gets into your tissues. It helps open them up like you do with your restorative exercise to help facilitate the range of motion. And we use that together with acupuncture to just give you a great full package where you can leave feeling your best and without the pain that you came in with.
And again, it certainly has worked well for me. I love your techniques. I love the massage that you do, which, like you say, is not relaxing by any means, but it's certainly effective.
Yeah.
And what is it? Do you call that type of massage?
Well, it's actually a host of different massage therapy types. There's the standard Swedish, which is what everybody knows, but I use something called neurostructural body work, which is injury management focused. I use a lot of Eastern medicine massage types, shiatsu, jinshindo, whatever's going to work for the person. Everybody who comes in has an individual problem, so they need an individual solution. So I use whatever techniques I have in my bag of tricks to get the body to perform the way that they are looking to have it perform.
And you've also done another technique on me with using glass cups, which
True.
is interesting.
Yeah, cupping. That's called cupping or fire cupping. Twinking is another name. It's a very unusual therapy. They use it in Asia, and it's also in some portions of Mexico and South America too. You create, more or less, you create a vacuum inside a cup of some types they use bamboo, but you apply that vacuum cup to the body. It sucks up the muscle and the skin tissue very gently. It feels very comfortable. And through that process, it allows the body the muscle tissue specifically, to relax. So if you come in, a lot of office workers really love this because they come in with tight shoulders, tight arms, and this helps them relax and feel good.
Great. And how old is acupuncture?
Oh my, it's thousands and thousands of years old. There are some written records where acupuncture has gone back as far as 10,000 years. What they used then, we have some of that still in there, but we use modern techniques, and a lot of our treatment options, we put in diagnostic systems and treatment systems of Western medicine too. So it's not like we've been kept apart from the world for the last 10,000 years. We're actively involved, and we are evolving and modernizing just like everything else.
What sort of qualifications does somebody need in California to be a licensed acupuncturist?
California is one of the states of the United States that you need a separate licensure to work in it. It's actually the toughest license exam of all the states. So we have a national license, and we have a California State Board exam, which is very rigorous and is the bane of many of the students here in California. But both exams need to be passed, and I have both myself, and that will license you to do certain things in the state.
And you were telling me that you work with a lot of dancers who have injuries.
Yes. Performance Edge, my clinic, most of my client base are professional and amateur performers, so musicians, dancers, artists, and also professional and amateur athletes from Little League all the way up to the Olympics. I've had many Olympians in my treatment space as well. And I take care of high performance individuals, people who use their body very dynamically. But that's not to suggest that that's all I do. Anyone coming off the street, someone who is crammed into an office chair 8 hours a day and has that type of scenario going on, we definitely see them and we help them too.
Great. Well, thank you so much for being on our show today, Jeff. And we're going to see you soon on the next episode of Body Restore, which will be about hip and lower back pain.